You can live your life with the treatment you get. I suppose the drugs that they give us are obviously doing us good. And I know I'm taking medicine, but I just don't think about it. I think it must be helpful because I really don't have too many worries about it.
There is currently no known cure for dementia, although there is lots of research going on to find one. However, there are drugs that will help to treat some of the symptoms of dementia or stop them progressing for a while. This depends on what type of dementia someone has. People who have Alzheimer's disease or mixed dementia, where Alzheimer's is the main cause, are usually offered one of 4 drugs: Donepezil, Rivastigmine, Galantamine or memantine. These are widely known by the brand names Aricept, Exelon, Reminyl and Ebixa, but there are others. These drugs all help to tackle the physical changes in the brain that cause dementia. The first 3, Donepezil, Rivastigmine and Galantamine, are usually prescribed to people who have mild to moderate Alzheimer's disease or mixed dementia. Some people find these drugs lessen their symptoms for a while. Benefits can include improvements in motivation, anxiety levels, confidence, daily living, memory and thinking. These drugs will initially be prescribed by a specialist, such as a consultant at the memory clinic. If one of these 3 drugs causes problematic side effects, it is possible to switch and try one of the others. People who have moderate Alzheimer's disease but can't take any of the 3 drugs we've just talked about, perhaps because of side effects, might be offered memantine, known as the brand name Ebixa. It's also become more common to be offered memantine in the later stages of Alzheimer's disease when symptoms become severe. The benefits of memantine are that it can temporarily slow down the progression of symptoms in people in the middle and later stages of Alzheimer's disease. It may also help with agitation or aggressive behaviour, which are more common in more advanced dementia. The last 4 drugs I've just described that are used for Alzheimer's disease aren't effective for people with vascular dementia. They're only given to people with vascular dementia when this is part of a mixed dementia with Alzheimer's disease. It may be possible to slow down the progression of vascular dementia by taking drugs that treat the underlying conditions. So the GP will often prescribe drugs for people with vascular dementia who are at risk of having a stroke, or who have high blood pressure, high cholesterol, diabetes or heart problems. In many cases, the person will already be taking some of these medicines. If they are experiencing distressing symptoms such as hallucinations, which is where people see things that aren't there, or delusions, which is when they believe things that aren't true, someone with dementia with Lewy bodies might benefit from one of the 3 anti-Alzheimer's drugs, Donepezil, Rivastigmine or Galantamine. In frontotemporal dementia, the anti-Alzheimer's drugs haven't been shown to offer any benefits and may even be harmful. Because of this, they shouldn't be prescribed. It's common for people with behavioural variant frontotemporal dementia to be prescribed antidepressant medication. This can help to reduce some of the inappropriate, obsessive or compulsive behaviours that are common symptoms of frontotemporal dementia. As with lots of medication, drugs to treat dementia can cause some side effects. For example, Donepezil can cause nausea or diarrhoea. For more information on side effects, talk to your GP. Drugs are not the only way to treat or manage the symptoms of dementia. There are many other things that can help people to live well. Talking therapies such as counselling or psychotherapy give people a chance to speak in confidence to a qualified professional about problems or issues that might be bothering them. They might help you to come to terms with the diagnosis and identify ways to live well with dementia. They may also help with symptoms of depression or anxiety. Talking therapies typically involve regular sessions with a therapist, either one-to-one or sometimes in a group. They can be face-to-face or over the phone. Some people will just have one session, while the others will have therapy that continues for many months. Alongside talking therapies, there are other non-drug approaches that may be helpful as dementia progresses. Some of the more commonly used ones are reminiscence therapy and life story work, and cognitive stimulation therapy. Reminiscence work involves talking about things from the past, using prompts such as photos, familiar objects or music. It can be one-to-one or in a group. Life story work is usually shared between the person with dementia and a family member, friend or support worker. A scrapbook or photo album is used to record details of the person's life. These techniques, particularly when done one-on-one, can improve mood, well-being, and some mental or cognitive abilities such as memory. At the same time, they can help others to focus on the person rather than their dementia. The services available and how to be referred to one of them can vary around the country. Ask your GP, memory service, or local Alzheimer's Society for details of what is available in your local area. Another non-drug option for people with dementia is complementary therapy. These therapies are outside of conventional medicine and are used to treat or prevent illness and promote health and well-being. Complementary therapy should be used alongside and not instead of conventional medicines. Anyone thinking about trying these therapies should tell their GP. Some examples of therapies that may help people with dementia are massage, aromatherapy, bright light therapy, where you sit in front of a light box, and music therapy.
I think I worry more about how Rusty's feeling, in as much as he gets a bit depressed with himself. I think that's probably my biggest worry. I think the fact that he worries about he can't do things like he used to, like he gets in a muddle if he tries to change plugs and can't get the television to work and things that he's always been able to do, so he gets a bit depressed about that side of it.
It's quite common for people with dementia to experience depression or anxiety, especially in the early stages. People who have vascular dementia or Parkinson's disease dementia are more likely to experience it than people with other types of dementia. There are both drug and non-drug treatments that can be used for depression and anxiety. Antidepressants work by correcting the level of some chemicals in the brain. But research has shown that common antidepressants don't work as well for depression in people with dementia as they do for people that don't have dementia. It can take several weeks to notice the benefits of taking an antidepressant. Many people experience some side effects to begin with, but these usually lessen after a week or two. There are other ways to treat depression that don't involve taking drugs. These include talking therapies such as counselling, reminiscence activities, and life story work. Other simple things that can help with depression and anxiety include keeping active, doing activities that you enjoy, and talking to friends and family. Eating a healthy diet and not having too much alcohol or caffeine can also help. To find out more about treatments for dementia, visit alzheimers.org.uk/treatment.